Thank you so much. As we all know, inherited retinal dystrophies are progressive, major cause of unreadable blindness, characterized by degeneration of retinal pigment epithelium and the photoreceptors. This is the typical conversation which happens in a retinal dystrophy clinic once we diagnose the dystrophy. You have retinal dystrophy, how do we cure this? Sorry, no cure. Can you do something to treat? So nothing to treat, but you can do low vision aids and consult rehabilitation services. Will this condition pass on to my next generation? You can go for genetic testing. Then the patient comes up with a series of questions like, does my vision going to deteriorate? Will I go blind? What can I do to avoid further vision loss? Can I expect something for the cure in the future? To answer these questions, this needs to be studied comprehensively in the Indian context. So ours was an observational study where we recruited 100 patients in the age group of 5 to 65 years. So all patients underwent comprehensive eye evaluation including imaging, and electrophysiological tests were done wherever it was required. Coming to the genetic testing, we use next generation targeted sequencing using a 240 retina specific gene, and variant calling in genes of interest was looked into. So we got so many mutations starting from Leber's congenital amaurosis to choroideremia. It's very confusing. What does this mean to a physician, patient, or a family? Can we use this data for a predictive and preventive and therapeutic model? I'll explain the same. This was a 43-year-old female who presented with macular dystrophy. When we did the genetic testing, we ended up discovering a totally new gene called SERPINF1 which has never been reported. Incidentally, the symptomatic father and asymptomatic children were also carrying the same gene. When we examined the father, of course, he had retinal dystrophy, but the children's fundus appeared normal and OCT was also near normal. But if you look at the autofluorescence, definitely there is an abnormality in the macular region. So this is the autofluorescence and corresponding OCT across 3 generations with increasing grade of severity. Next time if you come across, any of you come across similar gene, you know the prognosis and course of the disease. How to prevent this progression, I'll come to that in the therapeutic aspect. So this was one more interesting family where the daughter was symptomatic with macular dystrophy, and she had a compound heterozygous mutation in a gene called ABCA4 known to cause Stargardt's. Compound heterozygous basically means 2 mutations in the same gene at a different locations. And mother was asymptomatic was found to be homozygous for one of this gene, that is G196E. Fundus appeared normal, however, the autofluorescence OCT did show subtle changes in the perifoveal region. This is a typical example for same disease, same gene, same family, but depending on the mutation inheritance pattern, symptoms and the progression could be different, which is common in Indian scenarios. So most of the time there will be metabolic overload in macular dystrophies because of the lack of particular enzyme, because of the gene defect. If we can give dark glasses and avoid giving vitamin A or air supplementation, to an extent we can prevent the progression by eliminating the toxic byproducts. So therapeutic aspect, we have come a long way from genes to gene therapy. Gene therapy in simple terms means, it's correcting the effect of defective genes by using something called viral vectors. So we prepare this viral vector through a complex process where they are transpected into HAK cell lines, they are harvested, they undergo multiple purification process, finally resulting in treatable AAV particle. So we injected this AAV particle in mouse retina subretinally. This is the mouse fundus photograph and also green fluorescent tracking system confirming the subretinal location of our vectors. But there was a challenge here. Some of the large genes like ABCA4 cannot be loaded into the single vector. We came up with a novel dual vector strategy where we split the gene into 2 of. These were loaded into the separate variants. Once they got co-infected together, they reach the target site and they join back where they are intended to produce the expected proteins. So all these vectors from the scratch were produced here itself in India in our lab. So these are the micrographs of the mice, control mice, the intact vector one, the dual vector. If you look at the staining pattern of the intact and the dual vector, it is comparable. That means our vectors are reaching the intended site and producing the protein required. There are some challenges in manufacturing these vectors in gene therapy. That is the reason the currently approved drug for muscular dystrophy and Luxturna, they cost in crores, like 15 crores, 7 crores, which 99.99% of Indians cannot afford. If you want to bring down the cost, only way is to start producing the vectors here itself and study our population. So I would like to conclude my study under these headings. What we knew was genetic testing can help in accurate diagnosis and family planning. Gene therapy is efficacious. What this study adds is genetics of Indian patients are diverse and can be used as predictive biomarkers. Indigenously developed AAV vectors were studied successfully in animals, and also novel dual vector strategy in larger genes. The future plan is the small sample size could be a limitation. We want to collaborate with all of you to generate one of the largest database, Indian database for retinal dystrophies, and start producing clinical grade vectors so that we can start human trials. Thank you so much.
You recommend that vitamin A and these agents should not be used. We see so many patients, almost all patients are using vitamin A and antioxidants. So you think they should not be used?
Yes, sir. That is the lack of awareness. The vitamin A initially was started for the night blindness group of disorders. Recent data suggests there also it doesn't work. In macular dystrophy, it is contraindicated. basically what's happening is the more vitamin A you give, it is stimulating the visual cycle. Only the toxic byproducts are getting accumulated and it's offering no benefit. And these toxic byproducts, the vitamin A gets converted into bisretinoid. That is causing further damage. Even I see a lot of dystrophies when there is no treatment with a lot of prescription of steroids, which should not be given. It will further deteriorate. In fact, it hastens the progression, sir.
And this macular dystrophy, generally patient, again, we saw so many patients having all these macular product, antioxidant product. They should be used or no?
No, should not be. That's exactly the message which I conveyed in the thing. It should not be used because it will cause further metabolic load because there is already enzyme deficient to degrade these things, and if you supplement it, it won't. Because these dystrophies are happening for a specific reason, the mutation. Unless we correct that mutation, nothing else is going to help, sir.
Particularly, Dr. Nagpal sir recommends that in cases this retinitis pigmentosa patient, he recommends because there is less number of roads are there already degenerated. He says you can keep the light on throughout night so that one has to text on the roads is less. What do you think?
Yes, it's a good measure. In fact, that's what even I advise my patients. Vitamin A and again RP is controversial because the mechanism is again different. But up for light, that is the one of the first measure we take. We always advise my rod cone dystrophy and RP group of disorders to carry a torch with them and always be in a familiar surroundings. Light is good, familiar surroundings, they can move around.
Dr. Nagpal, in the night also, wherever you are sleeping, you should keep the light on
No.
so that when one gets up, roads are no text.
No,
it is not given in any book, but one of the conferences I was chairing with him, so Dr. Nagpal sir, he told this.
No, I understand why that concept came actually.
Keep the light on.
No, I understand why that came. In fact, the opposite was also tried. In fact, the pirates who cover one eye, some of the pirates who had the RP, they reported their vision was little better. This is like opposite to it. Basically, they are preserving their rods and cones. They are not getting, depolarized more so that they can see better. So that theory is also there. So that little controversial. So, thank you. No, that is very clear. Please, you can quote me anywhere. Thanks.